Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about Mycerts for medical billing and coding training. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so first things first. This is not an ad for Medcerts. That's number one. Number two, the only reason that I am doing this video is because I have gotten multiple requests over the last 2 weeks from multiple people sending me messages asking about this specific program. Number three, I am not affiliated with them. I am not promoting them. This is not an ad for them. It's not an ad for Medcerts. I don't know the instructors for this program. Okay, that's part of it. I don't know the instructors, so I can't say yay or nay when it comes to is this program good or not. What I can do is I can read from the website and tell you what a veteran coder is seeing from what is there on the website. So that I can do for you, okay? But I want you guys to keep this in mind. People will ask me all the time, Blue, what school do you recommend in online? The only 3 options that I can recommend personally that you have, okay? Not that there's not all these other options out there, but these are the only ones that I can say, okay. The associations, the American Health Information Management Association and the American Academy of Professional Coders, both have their online medical coding programs, okay? They both have payment options, okay? AHIMA, if you pay for all of the courses up front though, in the 13 course bundle, you only have 1 year to complete the program, all right? But you can purchase your courses a la carte, meaning that you can purchase a course at a time. So if financially it's better and easier for you to spend a few $100s at a time rather than a few $1,000s at a time, that may be an option for you, okay? And then you get however much time. I think it's like 6 months sometimes, maybe a little bit less than that. So really it all depends, and it may be better and more beneficial for you when you're, studying on your own, okay? So that's the first thing. AAPC does have payment plans for their programs, and so that's just something that you got to know there, all right? But again, both roughly are going to run about $5,000, okay? And that's with the books, okay? Then there's an independent study video. Now, I've done the independent study video myself, and I've done the syllabus based on what I recall from my own medical coding program, okay? And then some of the other things that I learned along the way that I know that medical coders need to know, all right? So I've made a video, and it has the syllabus, it has all the books listed and everything. I try to update the books every year, but sometimes people find one of my old videos from 2020, and they're like, have you done an updated one? Guys, let's just use common sense, okay? If you see a book I recommended this a 2020 version, you can pick the 2023 version, guys. It's that easy, all right? But I will say with the workbooks, you can use workbooks that are a couple of years old because they still have the same questions as the current year version of that book, but the current year version has the most up-to-date codes. And it's not to say that all the codes in there are changed. They're not. So you will see some if you use an older book, but it's still okay. It's still going to do the job. It's basically getting you to study. Okay, so with that said, that independent study video and all the links for all the books that I recommend, they're in the description box below, guys. Please do your research when it comes to that. So those are the 3 options that I say that you have, right? But if you're getting funding from a government program like Mycaa or Wioa, that's fantastic, guys. Use those funds, okay? Use what they have in order to be able to get educated. You can always use my independent video to supplement your learning, okay? So maybe you're not learning from the workbook that they're giving you from your school, right? Whether it's Mycerts or another online school. Maybe you're not learning from their books. But maybe if you look at what my independent study video has, maybe you might learn from that book, okay? So you can always broaden your horizons. Please do not get tunnel vision when it comes to study materials. Not right now. But I'm going to go ahead and read to you from the website. And again, I will leave this link in the description box below. So if you are interested in pursuing medical billing and coding through Medcerts, you certainly can, okay? And one other thing I will say is this. Sometimes these online schools will offer you other credentials Other schools offer like the CBCS. This one offers the MCBC, and it may be like specific to their school. And they say, oh, you're dual credentialed. Employers are looking for AHIMA and AAPC credentials, period. They're not really looking for all those other ones like the NHA and all these other ones. So just something to keep in mind when you're thinking about how much pressure you have to put on yourself to get these tests done, all right? They're looking for AHIMA or AAPC, all right? So here we go. This program is 28 weeks, 28 weeks in length, okay? So 7 months, right, to complete this program. The certifications that it's training you for is the MCBC. Again, I guess that's specific to them because, again, when I'm looking at job listings, I'm not seeing employers asking for MCBC, okay? They do train you for the CPCA or the CCSP. Now, keep in mind, the CCSP is a Certified Coding Specialist Physician-based. That is the outpatient medical coding certification from AHIMA, all right? So if you choose to go with AHIMA, you are all set and ready to go. If you choose to go with AAPC, they're saying that they will train you for the CPCA, okay? The Certified Professional Coder Apprentice, all right? And then it says the issuing authorities is the AMCA. I think that's the one for the MCBC, AHIMA, or AAPC. It says this program is not available for residents in the following states: Wisconsin, North Dakota, Rhode Island, or Louisiana. And it says, please review our state restriction page to view what restrictions there may be for your state or region of residence or employment and ensure that you are eligible for enrollment. These restrictions may not apply to students taking programs through an employer, academic, or government-sponsored model. Okay, so again, if you're taking it through Mycaa or the WIOA, this may not apply to you. Okay, that's what it's saying. To determine eligibility, please confirm with your sponsor. All right. So it gives you a little quiz to see if medical billing and coding training is right for you. It does give you a breakdown of like the tuition options, right? It says monthly payments as low as $242. Payment plans for every student. Talk with an education consultant to pick the perfect payment plan, from paying in full to installments with interest rates from 0 to 12%. If you pay the tuition in full, it is $4,000 for the medical billing and coding program. All right. There is no credit check. And then it says, again, about the Mycaa, Department of Defense, Credentialing Pool, and Workforce Grants, that they do accept those. So it says, what does a medical coding and billing professional do? A professional coder reviews clinical documentation and translates medical procedures, diagnoses, supplies, and services into codes that are submitted on a medical claim to payers for reimbursement. They serve a vital role in the financial well-being of their employing organization and indirectly influence patient outcomes through accurate medical coding. A professional biller utilizes codes assigned by the medical coder to process, submit, and track medical insurance claims. An individual with both medical coding and billing knowledge and training often fulfills both roles, assigning medical codes and processes healthcare insurance claims. Professional coders and billers demonstrate their proficiency by earning industry-recognized certifications. 186,400 entry-level jobs in the U.S. Medical coding and billing professionals will see available jobs grow 7% in the next 10 years. What you'll learn. Medcerts, Medical Coding and Billing Professional Program, covers foundational, intermediate, and professional level topics to allow graduates a clear pathway towards a rewarding career in billing and coding. I want to say coding and billing, billing and coding, primarily in a physician office environment, so outpatient coding. This 28-week online dual certification program provides training in areas including human anatomy, medical terminology, insurance billing and coding essentials, and medical coding. Dual certification with MCBC and CPCA or the CCSP can increase marketability. Guys, all you need is a CCSP or the CPCA. Flexibility and opportunity in the field of medical coding and insurance reimbursement in the outpatient setting. Students begin with Insurance and Billing and Coding Essentials course by gaining a high-level understanding of ICD-10-CM, CPT, and HCPCS coding without the use of coding manuals. That's what it says, without the use of coding manuals, in preparation for the Medical Coder and Biller certification. This course is a building block and provides a foundation for progression to an advanced understanding of medical coding. So this is why I say, like, for the longest time, the CBCS, which is another thing for another program, but it's one of those ones that they say, oh yeah, you'll get 2 certifications when you're done with this. So like those types of programs, they typically don't require books. The CBCS did not for a long time. Now they're requiring the people to have books when, like, coding manuals when they take the test. So this is probably one of those kind of similar deals. Just saying. Moving towards intermediate and professional level topics, the medical coding course provides comprehensive instruction related to reviewing documentation, abstracting details, and assigning medical codes for diagnoses, procedures, and professional services. Extensive focus and familiarity with the use of ICD-10-CM, CPT, and HCPCS coding manuals, and official coding guidelines will provide the tools needed to challenge the certified professional coder as an apprentice or the certified coding specialist physician-based, they missed the based part, certification. Both certifications are considered professional level. The primary objective for this program is to give students the tools needed to successfully pass the MCBC examination. Once MCBC certified, students are eligible for the optional but valuable, really this optional, CPC or CCSP certification, both which are considered the gold standard for medical coding in the physician office settings. Those who pass the CPC examination will earn the CPCA when the CPCA apprentice is ultimately combined with 1 year of practical coding experience. The individual earns the full CPC designation. Medical coders holding professional level certifications are critical to compliant and profitable medical practices and typically earn 20% more than non-certified medical coders. The payment for the MCBC and either the CPC or the CCSP exam is provided by Medcerts. So that's a good deal. I mean, it's saying that your certification is included. Now, listen to me when I say this, guys. If the certification is included with your program, you gotta take the test. So whether you feel ready or not, it's gonna be go time. Please don't be one of these people who gets into these programs and then doesn't take the test. They always say, well, I get that from time to time where people will write me and say, well, Blue, the test was included, but I wasn't ready and I didn't take it. You didn't even give yourself a chance to fail. You just didn't take it. Well, I was scared. Why are you so scared? This is not something that you have to memorize all the codes. You get to take the books in there with you. So at least give yourself a chance to fail if that's what you're thinking that you're going to do. But believe it or not, sometimes you know a lot more than you think you do. Okay, so I'm just going to leave it like that. And it says, accurately locate documentation in the patient record to support coding and billing processes, submit claims for reimbursement based on payer policies and procedures, review patient records and assign numerical codes, it's alphanumeric, for each diagnosis and procedure, specialize in physician-based settings such as physician offices, group practices, multi-specialty clinics, or specialty centers. Provide practical application of coding, operative reports, and evaluation and management services. Everybody's favorite. All right, so enrollment requirements, high school diploma or a GED. if you don't have a GED, if you don't have a high school diploma, get your GED. Okay, that's my advice. Web browser and internet connection, and of course, course registration and payment. Then Medcerts covered materials. The cost of all materials needed for this program are covered by Medcerts. They are not included in the tuition costs, and the student is not liable for any cost or fees related to the above materials. Okay, so it's all included. All right. Expert-led video-based training. Okay, you're going to be learning from videos. All right. An ebook, medical insurance, a revenue process approach, textbook, the CPC bundle, text and coding resources. Okay, I can get behind that. The textbook, Bucks, step-by-step medical coding. That I cannot get behind. So if you watch my channel, you know how I feel about Bucks. This is my own personal opinion on Bucks, okay? I personally do not like the way the Bucks is set up because I feel like it's not very beginner user friendly, all right? It is for people who are already coders and they already know. I know because I have several Bucks books, okay? I have tried to give Bucks a chance, but that is the one thing that I never feel comfortable with when people tell me, well, I'm learning from the Bucks book. Me personally, the book that I recommend for learning the medical coding part is in the description box below. It's the ICD-10-CM and ICD-10-PCS Coding Handbook with the Answers by Nellie Leon Chizen from the American Hospital Association. That is the book that I recommend, okay? And I recommend the CPC study guide, right? Which you're getting that in this bundle here. But for the diagnosis part, I really recommend that Nellie Leon Chizen book because that is a fantastic book. It's got everything that you need to know. You can certainly skip the ICD-10 PCS portion because that is not related to outpatient, okay? So all you want to do, if you get that book and you want to study this, is study the ICD-10-CM part. That's all your diagnosis coding, okay? So you can totally use that book. It's a fantastic book, I'm just saying. So even though you get this book from them, it doesn't mean that you can't supplement your learning, okay? So I'm just going to leave it there. Competency assessments are also included. National certification exam fees, MCVC, and the option for the CPCA or the CCSP examination. Student services, dedicated student success advisors, tailored support based on performance and behavior. That's weird. Exam preparation process, and 1 year post-program access to the Career Center and career coaches. Okay. So they say that professionalism in allied health is 2 weeks. That's your first course. Your second course is Introduction to Human Anatomy and Medical Terminology. That is 6 weeks. Insurance and Billing and Coding Essentials is 6 weeks. And then Medical Coding is 14 weeks for a total of 28 weeks, so 7 months. Okay. And then it talks about like the job opportunities and stuff like that. Professional medical coder, medical insurance specialist, medical biller. Okay. So that's what they have there. So it is available if you have access to those grants, government grants, to be able to go to school. It is okay to go through these types of programs, but know that you are going to be teaching yourself a lot. If you get a really great instructor in a hands-on group, then you are fantastically lucky for that. If you don't, it is also okay. It is not the time to look around and think, poor me, why did I get such a horrible program and I should have done this and I should have done that. No, you can learn, guys. You can learn on your own with these manuals. And again, if you don't want to get the Nelly book that I recommend, but you want to learn from the Bucks book that they give you, that's totally fine, guys. You can totally do that. All right. But it's just a matter of once you get studying, you're going to see the difference. You will see what I'm saying when you get in it, okay? But if you have the opportunity to get your schooling paid for by one of these programs, that's really great. Or if you're paying out of pocket, again, it's roughly around what the average price is. So between $4,000 and $5,000, that's still a good deal, okay? Considering that some of these other online medical coding programs are $15,000 and $20,000 for a certification course, right? And they're just as short, if not shorter, okay? So that's the thing. And I always say 9 months, 12 months, or 18 months. This program is 7 months. So it's a little fast for me, but it's okay. It doesn't mean that right as soon as you finish that you got to take the CCSP or the CPC. It just means that if you have a time limit to be able to sit for your certification afterwards, like maybe they give you 90 days, then you need to take your test, or at least give yourself the opportunity to take the test within those 90 days. So that way all this stuff can still be in your brain and in your mind, and you're not going to forget it, okay? Take everything that they're giving you, because you're paying for it. Whether you're paying for it with time or whether you're paying for it out of pocket, you are paying for this program. So this is an okay program. I didn't see anything out of the ordinary or anything that was really weird. I think it's great that the cost of the examinations is included in the in the tuition fee. That's great. But if you are trying to decide between a HEMA or AAPC, I've done videos on that. There is a difference because AAPC requires you to pay for a membership fee every single year, and it's 36 continuing education units for one certification, where a HEMA is you don't have to pay a membership fee every year. You do have to pay to report your CEUs, but it's not what they would make you pay if you're paying every single year for a membership fee. And also it is 20 CEUs for one certification, okay? And employers do look for the CCSP. There is no apprentice status on that at all either, okay? So I will say that. AAPC is the one that does the apprentice status. That's an AAPC thing. A HEMA does not do that. So with that said, it is up to you, whatever you choose to do. And guys, you're the one who's going to be learning this. You're the one who's going to be committing the time or not committing the time in some instances. If you do not commit the time and you do a lackadaisical approach, that's the response you're going to get, whether you pass the certification exam or not, okay? If you happen to get lucky and you do pass the certification exam, let's just say, if you did not spend the time to learn in the program, it's going to show when you get out in the real world and these employers test you. They test all of us, even veteran coders, on knowledge. So they will give you an assessment test to test you again. You will be repeatedly tested throughout your time searching for a job. And then even when you get your time in and then you go on to your next job, you will still be tested again, because it is about knowledge in this field, okay? And it is on us to be able to build that knowledge. And on my channel, I've given you guys so many resources to be able to do that, okay? So that's just my advice anyway. I can lead you to the water, but I can't make you drink. So it's up to you, you know? With that said, I'm going to go ahead and wrap this one up because I'm almost out of time. But if this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye!